Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business policy and practice. The Imprint Weekly Podcast is also a member of the Safe Camp Audio Network. You can check out our show page there and all of Safe Camp's other great podcasts at safecampaudio.org on the web, at safecampaudio on all social media. On today's episode, we are talking to Aditi Shrivastava of the Center on Budget and Policy Priorities about the Temporary Assistance for Needy Families program known widely as TANF, and about the many guaranteed income projects that have popped up around the country. If you listened to the podcast over the summer, you know we had another policy expert, Ashley Burnside, come on to talk to us about a new proposed rule for how states could implement and use TANF. It's been proposed by the Biden administration. That is still out there. It has not been finalized yet. We'll see if that happens before the administration winds down over the winter. Aditi and I discussed that proposed rule a bit, but explore more broadly what has gone on with TANF in recent years, as well as a new pilot project within TANF aimed at thinking through kind of new ways to frame and measure the program, which right now is currently very fixated on workforce participation rates as sort of the North Star in the sky for TANF. And then we spend a little bit of time at the end talking about guaranteed income projects, what we know about them so far. I asked Aditi a little bit about some outcomes from a very large guaranteed income research project and, just what the right way to evaluate them and measure them is. So without further ado, here is our conversation with Aditi Shrivastava. All right, we are joined today by Aditi Shrivastava, Deputy Director of Income Security at the Center for Budget and Policy Priorities, to talk about the Temporary Assistance for Needy Families program. You know it better as TANF. And we'll talk a little bit about guaranteed income projects in the United States, since Aditi knows that subject well. So Aditi, thank you for joining us on the Imprint Weekly Podcast.
I am so glad to hear it. Thank you.
So before we get into the weighty issues of income supports for families, let's let these guys know something about you. You got to give me at least one of your favorites in these categories: movie, TV show, book, musical group, or sports team. You got to give me one. You can give me all five if you want, Aditi. What do you got?
Well, since you said we have more serious things to discuss about, I'll say just one of them. I am a very avid reader. I probably read more than is good for me, but that's also just the medicine for my soul. The one that I always go back to, I first read in the 7th grade, is Anne of Green Gables by Lucy Maud Montgomery. There are 8 books in the series, and all 8 of them are fantastic to read. So that's my recommendation for today.
I dig it. I don't think I've ever heard somebody be concerned about being too much of a reader. I kind of aspire to be just a slightly better reader.
Well, my problem is that if I like a book, the rest of the world can just stop existing, including a good night's sleep, which even as an adult, if it's a good book, I need to finish it.
I used to be like that when I was a kid. I kind of almost want to get a little bit of it back,
Yeah.
Only me and my mom and my dad know this. There was a time where I just read so long with one of those night lights and it almost caught on fire.
Oh,
and it was like they came in and it was melted to my robe or whatever I was wearing, my PJs, But now I feel like at 45, I don't think that would be a problem. I start reading and 20 minutes later, safe bet, I'm asleep. So anyway, that was a lot more about my reading habits than you needed to know. Let's talk about TANF first. And we're putting this out in the fall. Me and Aditi are talking in August, so you're probably hearing this in the early fall. But we, over the summer on the Imprint Weekly Podcast, went over kind of doing some 101 primers on all these rules that the Biden administration has put out or introduced over the year. One about kinship care, some about LGBT placements in foster care. And one of the ones that we talked about was the proposed updates to the Temporary Assistance for Needy Families program. So I will drop a link to anybody that wants to listen to that. It was a really good episode. Ashley Burnside did a good job just kind of laying out, okay, here's what they're proposing. So I don't think we need to go into that necessarily, other than to say basically it was aimed at honing in on who is eligible for cash support under TANF, and then kind of putting some guardrails in place on what other things states can do with their TANF money. So I think I'll just start with just asking you, what are your thoughts on what this rule would accomplish, and what doesn't it accomplish that you think still needs to be kind of acted on either by Congress or whoever becomes president next?
Absolutely. So first off, I really appreciate the attention that you pay to all of these issues, because I think everything that you've named so far is really near and dear to my heart. And so it's great to be able to have this space to talk more about this. In terms of what these regulations are doing and what more can be happening, if we take a step back and we look at what's been happening in the TANF world, and let's say the last year or so. So really quick abbreviated history lesson. TANF was passed in 1996, so it's coming up to about 30 years old, and there hasn't been very many changes in the program since it was first enacted. So there's been a few significant changes over time, but in general, it largely stays the same. So we're actually pretty excited that in the last year, there's been a lot that's been happening in the TANF space, including this proposed TANF rule that you're asking about here. So if you set aside all of the details of what it's doing, right? Very broadly, we see it as motivating states to spend more of their money on TANF's core purpose, which is providing cash assistance to needy families. And when you asked what more can be done, so with the way that the statute is written, HHS cannot tell states directly that this is how to spend your TANF funds. TANF is intended to have and to provide a lot of flexibility to state TANF agencies and to states. And so what HHS is doing is it's really considering a lot of the different ways that states have been spending their TANF funds, and on the whole, having them reconsider whether where the funds are going right now is where they should be going. I'm really hopeful that it will be finalized, because it's absolutely pushing TANF in a better direction. And the sum of the proposed changes really will, we think, make a positive impact in TANF. I unfortunately don't know whether, when, and how it's going to be finalized. Right now, it is it's a proposed TANF rule, and what remains is for that rule to be what we call finalized, at which point then states would need to follow it. Yeah.
So let's assume for a minute that it does get finalized. And so we have this rule that is, I think you described it right. It's not really putting hard and fast new compartments on states, but it's changing it a little bit. It's reining in some of the flexibility that the program started with. So if that became final, what would you and other advocates, for TANF, or don't put other people in the box, what would you and CBPP like to see as sort of a next step? What would be the thing you'd be asking that next administration to consider, or Congress?
Absolutely. So I guess if this rule gets finalized, right? When this rule gets finalized, the next step is actually going to be up to states, because then it is going to be up to states to actually go back and look through where and how are they spending their TANF funds. We anticipate that many of them are going to revisit some of what they've been spending it on, and consider whether it is the best way to be using their TANF funds. The proposed rule also has a definition of what needy is. And up until now, that really hasn't been defined for TANF. And so if there are states that have programs that are providing to families above that, right, they will be revisiting that. So what that will do, though, also in that moment, right, is that if there are funds that were previously being spent in a particular way that now no longer are not, that means that there are a pot of funds that a state could reconsider. And we would hope that in that moment, states would really look at how to provide those funds as cash assistance to families. Because I think, especially in the last almost 30 years since TANF has been created, the evidence base of what can happen when you provide unrestricted cash to families has grown tremendously. We've seen this coming from many different places. We've seen how much cash benefits families, how much of a positive impact it has in the short term and the long term. And so Right now, states are spending less than a quarter of their TANF funds towards basic assistance, meaning cash to families. So that means that there's a significant chunk of money that could be coming back as cash to families.
And that's like flipped. Sorry to interrupt, but that's like flipped since the early days. Like when TANF started,
yes,
it was mostly going to families.
exactly. It was mostly going to families in the form of cash assistance, and then TANF has just provided so much flexibility that over time, state policymakers have made policy choices. And I just want to be clear that these are active policy choices that get made by state lawmakers and by state agencies, so policymakers in a broad bucket. And so that absolutely can be changed also. And so in the way that they have chosen to spend less and less money towards basic assistance, they can choose to increase more of that, because it's not just that they're spending less of their TANF funds towards this, it's also that they're serving less families than they were previously. And the way that we measure that is when you look at a state and when you consider for every 100 families in poverty, we have a measure where we look at for every 100 families in poverty, how many receive TANF. And all states have seen a decline. TANF nationwide has, of course, seen that decline. In 2020, for every 100 states in poverty, only 21 were receiving TANF cash assistance nationwide. And that number varies very, very drastically by state. But in every state, we've seen a decline. And so that is a decline that can be changed. States can actively choose to provide more assistance to more families who need it.
Yeah. One thing that a lot of states do that really relates back very specifically to what we cover here at the Imprint, which is mostly child welfare and youth justice, is they will. So some states, and I think that what this is kind of called out specifically in this proposed rule, use some of their TANF money for like just foster care, which the Biden rule is kind of saying that's a no-go. That's, you're paying for separation. That's the opposite of what the point is. But then there's this other kind of use for that's kind of prevalent in kinship care, which is called this child only grant. It kind of travels not with the parent, but with the child if they're, say, living with a grandmother or an aunt or whatever. So that is largely kind of supported, I guess, in child welfare, even though a lot of people feel like that's a much lower amount than if you were, giving somebody a foster care payment. But I'm just curious, for somebody that kind of advocates and works on policy broadly about TANF, how do you guys see the child only grants as like a good thing or something to be potentially narrowed in favor of other support strategies? Like, how do you guys think about child only?
Well, so I want to think about child only really in the context of TANF's broader purposes, right? So TANF has 4 purposes that have been written into its originating law. And the first one is to provide assistance to needy families so that children can be cared for in their own homes or in the homes of relatives. So it begins with saying that children being cared for in their own homes. I think it's been over a year now since Chapin Hall has put together this really remarkable body of research that shows pretty unequivocally that if you provide families with economic and concrete supports, right, that reduces their risk of child welfare involvement. And they have TANF specific findings in there. So we know that so like going back to what I was saying earlier, right? Cash has a lot of benefits for families, including reducing their risk of becoming involved in child welfare. And so I think that's where I'm going to say this multiple times today. You'll probably get sick of me hearing it. But what we very sincerely believe is that TANF assistance should be going to TANF families. And one added benefit of that would be that then children would be more able to stay in their own homes. Because I think the other nuance to child-only cases is that it can also be families where the adults are no longer eligible to receive TANF benefits and so it can still be their own parents. Like absolutely, yes, kinship care is also a situation of child-only cases, but there are also cases where children are with their parents and the parents are not eligible for a number of reasons.
But the child is.
Yes. So again, it's a policy choice that a state can make.
You work on this policy from the advocacy and policy side now, but you were in there. You worked for the Administration for Children and Families at one point on TANF. I'm wondering what you can tell our listeners about, and I know this risks getting into super wonky territory, but I do think it would be interesting for people to learn about. What does it look like to administer something like this on the federal level? And manage and scrutinize what states are doing and what interactions do you guys have with states? Like, what does it mean to manage TANF on a federal level?
Yeah, well, I guess then I should start with being very clear that I was fairly junior when I was there. So this was right after I had finished grad school, and it was immediately out of grad school that I was hired
Right.
into work for the Administration for Children and Families. It was actually a really exciting time to be working for TANF because this was when the economic recession had happened and when President Obama's term had started. And at that time, as part of the American Recovery and Reinvestment Act, TANF had been allocated an additional $5 billion to use over the course of 2 years. And so this was 5 billion in additional to the annual 16.5 billion that gets allocated to TANF. And there were a few discrete ways that state could apply to spend those funds. So it was a really fun, interesting time to be there. We were getting to see a lot of innovation and creativity on the part of states when it came to proposing how they could use these funds. So two of those categories, one of them was what are called non-recurrent short-term benefits. And I feel like our conversation is going to go a little bit in a loop right now
All
because
good.
okay, because I'm guessing that a little bit later we're going to talk about RX Kids, which has just started in Michigan this year, right?
We
Which
sure
is
can. Yeah.
exactly. So RX Kids is providing 1 year of cash prescriptions, as they call it, right, to the families of all children born in Flint, Michigan. And some of those families is like part of their payments are going to be coming via TANF in the form of this non-recurrent short-term benefit. So this is a really innovative, creative use of TANF going to low-income families. And we saw something similar happening during that recession time when TANF had those stimulus funds, right? When it had those additional 5 billion. So there was a lot of creativity being proposed by states in how to set up these NRSTs. And the other thing was subsidized employment programs. And so subsidized employment programs, again, there can be a lot of variation in how states choose to set that up. And we were getting to see a whole bunch of creativity being proposed by states because obviously it was during the recession for people, certain communities who were already impacted were also then maybe having a harder time with the labor market. And so the subsidized employment program was able to address some of that, right? And was able to help get people who may be having a harder time getting into employment do so. Yeah. So I mean, I think those two examples definitely come to mind. What questions do you have for me there?
Well, I think thank you for that because I think that was really interesting. Also, I guess my question is, what does it operationally look like to oversee this? Like, how does it work in terms of? So we're talking about different efforts that federal government or Congress or whoever is making to change the way that TANF operates. Well, I guess in the present day, does a lot of the work of knowing what a state is doing with its TANF dollars and either approving or denying or pushing back or supporting things or whatever happen on that front end? Like we see that in Title 4E, with child welfare. A lot of the work is done with presenting a plan, and you get that plan approved in different ways. Is it a lot of that, or are the folks at ACF that are working on TANF a lot of the time kind of looking at TANF money that's already been spent, and that's sort of the primary way where we find who's doing things right, wrong, differently, whatever?
I mean, honestly, it has been so long since I have been at HHS that I think it
Yeah,
would be more appropriate for me to answer this
fair
question
enough.
from where I sit now. But I think that the answers are still largely consistent. That we know that states do submit TANF plans that have to be submitted to HHS. I think so much of what is being addressed in this proposed rule that you and I were discussing earlier, that actually comes from how much authority HHS has over what they can do with those plans. So even things like developing that needy definition, right, of 200%, or when they're proposing what is happening with the reasonably calculated, and I'm guessing Ashley talked about this, but the whole provision of being reasonably calculated to accomplish a TANF purpose, in adding the additional reasonable person standard to that, those are pieces that are not in place right now. So HHS is not able to do those pieces. And so, yes, states do submit their TANF plans on a periodic basis. In addition, they also then submit, caseload information, they submit spending data, all of which then HHS does share on their website. But I think, from the advocacy perspective, there's always been less information than we would like available about TANF. And particularly when it comes to the funds that are being spent in non-cash assistance. So as I was saying earlier, at this point, less than a quarter of TANF funds are going towards cash assistance, which means that you have over 75%, so over 3/4 that are going to non-cash assistance, and we know even less about what is being spent there. So I think that there absolutely is, in an ideal world, a need to have more information about where those funds are being spent. But also, honestly, in the long run, if this rule gets finalized, ideally we would see less funds going to non-assistance things, and then hopefully there would be a little less of a need. But I don't see myself ever being in a position of not wanting to know more about how those TANF funds are being spent.
Right. Well, it's yeah, it's a minutia, but I guess the reason I got interested in that and wanted to hear your perspective on it was just because I think there's always a tendency to, we finalize this rule or we pass this law and it's like, we did it, guys. TANF is better. And that's not the case. I mean, all it does is set up what would then have to be, it would really be on the federal government to make sure that that's being lived up to, right? Like, I guess I think of this as for the prism of, there's the use of TANF in some states to pay for elements of foster care is controversial. I think, to the point where they decided they needed to specifically regulate around it. That's different to me than like perhaps the incident that might have helped move this regulation along, which was the sort of infamous now use of some money down in Mississippi that involved a famous quarterback, Brett Favre, to pay for this volleyball court or arena or whatever it was. How does something like that get through if people are submitting a plan? Is the question. I think I guess I had that in mind as I was asking.
Yeah, and I think that is a very valid question. Like, what happened in Mississippi should not have happened, and that there should be safeguards in place, right? That keep something like that from happening. I guess I want to go back to what you were saying earlier about if this rule gets finalized, just assuming that, everything has been fixed. I can't think of anyone in our TANF world who would feel that way.
No,
And
definitely not people like you. I think it's more a
yeah,
tendency by government to say like trumpet this and all the energy goes out of the room and nobody looks again until 20 years ago, and it's like how do we still having problems with TANF? We fixed it, I thought.
yeah, well, I mean,
Yeah.
so honestly, the nature of the way that policy change works is that more often than not, it is incremental.
Mhm.
And so this would be I mean, it would, if it goes through, right, it would be significant positive change. And in the bigger picture, you can also see it as incremental change. And the thing is, like, there are other moving pieces in place as well. So last year, when the debt ceiling negotiations were happening, TANF was actually brought into that conversation. And in the law that ultimately passed, the Fiscal Responsibility Act of 2023, one of the things that was proposed in there was actually a pilot in 5 states. And that application window is open right now as you and I speak, although I'm guessing that it's going to be closed by the time that your listeners will get to hear about this. But that is distinct and separate from the proposed rule that you and I have been discussing so far. And in my mind, it is another incremental step moving TANF forward. That pilot is an opportunity for up to 5 selected states to work towards outcomes for the families who are in TANF, rather than right now, every single state is measuring work participation activities. So for every adult who is in TANF, they are subject to work participation activities, and then that gets reported by the state to the federal government, and the federal government has a measure called the work participation rate. And we've heard over and over again from the people using TANF and from the people administering TANF that that's not very helpful. And also, if you are wanting to set people up for success, for self-sufficiency for the long term, if you're measuring what they're doing right now, is that really the right measure? So what this pilot is doing is it is instead shifting that focus. It is saying to states that, you tell us how you want to set up a TANF program, what your ideal TANF program would look like, and what is an ideal state scenario in thinking about how to engage people who are coming into TANF, or to think about who else should you be serving, who else should your TANF program be serving, who they're currently not, right? And then when you are serving all of these people, what are the outcomes that you want to work towards? And that's the pilot that states can be applying for right now.
I'm glad you brought that up because we did write a little bit about that as they began to seek
Okay.
their pilot participants. Can you give listeners some examples of what you would like to see a state that took this on and was part of the pilot start to measure or peg their performance to that is not work participation? What are, just give me a few examples of some of the best ones in your mind.
So that is going to depend so much on the intervention that that any state is proposing. I would always begin with what is the actual change that a state is making to its TANF program, and then consider what are the outcomes that are going to be impacted. Because we know, and I mean, like, this is where I want to be mindful of how much other expertise exists in the world right now. I am so heartened that HHS has recommended that states consult with people with lived experience of either using TANF or people who should have been able to access TANF, that states consult with their community partners and with their advocate groups about where TANF in their state should go. Because as I was saying earlier, there's 51 different programs right now. I wish I could tell you very broadly that, like, hey, all 51 should be working towards this, but I don't know that that's where we want to be going right now, because what this pilot can do is that it can actually have 5 very different pilots that are doing different things, all moving families towards better places and really working towards outcomes. Now, I will say, to be very clear, right, that HHS and its application has made very clear what those groups of outcomes are going to be, right? And there are some distinct definitions in there. States will have flexibility to define some of their own outcomes as well, but just to ensure that there is comparability across all of the pilot sites, there are also some predefined ones that the HHS will be using.
My layman's reading of it, when I was just putting something together for our readers, was this is still predicated on TANF being a welfare to work program, and you would still need to have work outcomes in there. But am I wrong on that? It doesn't necessarily need to be participation rate, which might be problematic for some reasons, but that you can't just like untether TANF from eventually seeking work or having those opportunities. Am I right about that?
Yes, so that part is correct. It is absolutely, I mean, TANF is about moving families into self-sufficiency, right? It does include also participation in the workforce. But I think that this is also looking more broadly at what families experience and what are the experiences that are bringing them into TANF. If you are a family that is escaping a situation of domestic violence, if you are a family that is experiencing housing instability, right? Until you can actually stabilize those situations, any focus on getting you to work is not going to be the right focus. And so what does it mean to have a TANF program that's actually able to meet families where they're at, that is able to address their needs as they come through the door, rather than coming at them with a like preset list of like, these are the things that you need to be engaging in, pick one, like do one of these. Like that's not help anyone. Yeah.
It's almost like, would one way to look at it be like, these states will test out whether it might be more impactful for them to aim TANF at the first order effects of workforce problems instead of just the simple, did you get a job or not? Are you working a certain number of hours or not?
Yeah, I am hopeful that we will be able to see a much more detailed and a deeper picture at what it is that families experience when they come into the program, and also how states can best be serving them, right? Like what happens when a state is not having to worry about all of the paperwork that comes with making sure that they have the documentation in place to be able to report, right? When they are freed from those administrative burdens, what more can these case managers and social workers and caseworkers be doing?
Are you a professional in the field of child welfare, juvenile justice, or other family and youth services? Subscribe today to Youth Services Insider, the imprint's exclusive section on all the insider news you need to stay in the know. Funding opportunities, major federal and state policy shifts, interviews with key leaders in the field. It's all available only for our Youth Services Insider subscribers. Sign up for a monthly or yearly subscription today by visiting imprintnews.org/subscribe. Our podcast listeners get 10% off their subscription by entering the promo code PODCAST10. That's imprintnews.org/subscribe and get 10% off your subscription by entering the promo code PODCAST10 today.
All right, let's pivot from TANF to guaranteed income, which is another subject that Aditi focuses on in her work quite a bit. Let's start with this two-parter for you. I just want to give you open platform to talk about two things. One, what particular guaranteed income programs you're most excited about that are out there? And then which studies or measures of impact thus far on guaranteed income programs do you feel have been the most persuasive or presented, the strongest body of evidence that these programs are having the intended effect?
Yeah, absolutely. So I guess my entry into guaranteed income space has really been via TANF and via thinking about it from the TANF lens. So I really think about it more from the lens of unrestricted cash provision. And unrestricted cash provision, direct cash transfers, even when you look across the world, across the globe, like there's a robust body of evidence around how helpful it can be. I think because I come at this from a TANF lens, I really love seeing what's happening with RX Kids in Michigan, right? Where they have taken this very creative approach to being able to use TANF funds to serve low-income families in a way, in a moment. So really, when you look at the experiences of families at the birth of a child is when a family is most likely to experience poverty. And there are many factors to that. And then on the flip side of that, that first year of development in a child's life, right, is so incredibly critical. And so being able to address both of those via this one initiative is really, really exciting to me. I'm not in a place where I can name what the state is yet, but I know that there is another state in a more conservative part of the country that, inspired by RX Kids, is also on track right now to use their TANF funds to set up something similar to provide. They will be providing it as one-time grants to low-income families that are expecting.
Oh, a little half breaking news here on the on the podcast. So I'll know. I guess I'll probably figure out when that is, which state you were talking about. But are you saying so RX Kids? I think maybe we should go back just quickly and say RX Kids is a relatively new program that is truly. I mean, some guaranteed income programs are quite targeted. This one it's pretty population level for all Flint. Basically, these are guaranteed income payments made to any new parent.
Yeah, they are calling them cash prescriptions.
Right.
And because when you look around the world, there are many countries that do recognize the vulnerability, but also that critical nature of that first year of a child's life. And in recognition of that, providing these cash prescriptions, as they're calling them, to families. What is actually really exciting, so you are right, right now this is happening in Flint, Michigan. The state's budget that passed this year has an additional $20 million going to this. And so they are looking to actually expand this program to other parts of the state. And so it's really in inspiration from RX Kids that there's now another state that is actually looking to recreate a program like it. They will be targeting just low-income families, but I think they are expecting to serve about, I think it was 5,000 families over the course of 2 years, which is really, yeah.
Right. And there's already a state that's interested. The head of the RX Kids program was just recently on a White House convening talking about it. So I wouldn't be surprised if some more people don't start to.
Yeah, there are many states right now that have interest and that are looking into how they can set that up for themselves. Absolutely.
Yeah. The reason I asked the other part of this is because, I'll give you a chance to answer. Several researchers are out recently with a kind of first print on a larger guaranteed income test. This is the Open Research Project that provided, I think it was $1,000 a month to, I think, like 1,000-person treatment group. And, that study found a pretty slight reduction to work and work income. It didn't really have any, the early prints anyway, no real sustained change on health, although there was some pretty significant increase in an entrepreneurship among the treatment group as opposed to control. So I'd say that's largely been received as this is not a technical term, a meh assessment so far of that program. Have you had a chance to review that study? What do you think? And like I asked you before, what studies have you seen that you would say are more persuasive of GI's potential in your mind?
Absolutely. So I am less familiar with the details of this particular study. I feel like I saw it and then it's been on my to-do list to actually look more deeply into it. But frankly, all of our focus right now has been on the TANF pilots, right? And then help folks think through what that can look like. So I haven't had a chance to look at that. What I can say, though, is that I think rather than a particular study, what excites me right now is that there is a very robust and growing body of evidence that makes clear what the benefits of unrestricted cash are. I come at this from the lens of what is going to help low-income families, about what is going to be best for children. For me, when I look at that body of research from Chapin Hall, again, it's clear that like even if that is the benefit that you're looking at when it comes to unrestricted cash, that is such a significant benefit. Like there is trauma associated with becoming involved in the child welfare system. And if that could be entirely avoided, like that alone is so significant to me. You know, short-term health effects, long-term health effects. I think just in every single measure that I can think of, right, there are so many ways that we have heard and that the evidence is indicating that cash works. Most importantly, though, the people who are receiving this cash, the people who are receiving unrestricted cash from any of these measures, when you actually talk to them about the difference that it makes in their lives, I think that is, to me, what is most important, right? Is when you hear from the people who are getting these benefits just how much of a difference it does make. I think that is what is most consequential to me, because even in the TANF pilots right now, right, like we are in a place now where we recognize that people know what is best for them. People should be able to make decisions for themselves, for their families. That is where we are also looking forward to seeing TANF moving when you consider what is happening with the TANF pilots. So yeah, like having programs that are able to center people, that are driven by the voices of the people who will be impacted by them, to me is what is most meaningful.
TANF funding is being used to, in part, pay for the guaranteed income project or pilot in Flint, RX Kids. But do you view TANF generally as a guaranteed income program, or is that a too simplistic way to see? I guess I would have thought of TANF as more a conditional in some ways than to classify it as that.
I guess what excites me is the potential of what unrestricted cash programs can do and what the evidence there is showing.
Mm-hmm.
RX Kids is also a direct cash transfer program, and it's an unrestricted cash transfer program. So it is partially funded using TANF funds. So low-income families who are being served by it, their first 4 months, and this is getting into the super wonky details of what a non-recurrent short-term benefit is in TANF, but that is being funded in part by TANF. So yeah, I mean, so TANF cash assistance right now does come with requirements, right? You are right. It does have child support enforcement requirements. It has work requirements. It has time limits, but this is what excites me, right? Is that we're in this moment right now where we have, it's not even 2 tracks, because to me, like a lot of this stuff is intertwined, especially when you look at RX Kids, but we are simultaneously seeing this growing body of evidence of the benefits of unrestricted cash and what it can do, right? And we are in a moment where within TANF, we are seeing innovation and creativity and change being possible, right? And states being able to engage families on the families' terms and on the state terms and not be restricted by other measures to really set them up for long-term self-sufficiency. Like what happens if you have a model where it's not immediately punitive and where it doesn't assume, honestly, like sometimes the worst of people? Like what if you come in and you can continue to get your cash assistance, and hey, sometimes we're all human and we mess up and something goes wrong, but that doesn't mean that we're going to cut your cash grant. We're going to continue to meet you as a person, and we're going to continue to work with you to help move you towards self-sufficiency.
What do you think is the fair way or the right way for these programs to be measured and evaluated? Because on the one hand, I don't think it's rational to say the only way that this myriad of different GI projects all over the country that are targeted at different groups and taking different slices of the population, the only way that to say that they work or should be continued is some enormous percent increase in something. You know what I mean? Like that's just not how things work. On the other hand, I do think, this is one early print with the open research thing, but that was a very large project. Mm-hmm. And it didn't really show. I don't really think that the work, personally, my kind of first read of it, I was like, I don't think it's like a huge deal that there was a slight reduction in work, because I don't think it was ever the plan was for like people to not work or work based on this or whatever. The health one was a little surprising to me, but I guess short term, it was like a short study. So all that to say, I think it's like if all we ever see are evaluations that have fairly tepid results, I think the excitement that people have around this would wane. And so that the question becomes like, what is the right way to determine success in this space? And how do you think about that?
Yeah. So again, this is where I come at this from the TANF framing. So I think when you have a pot of funds that are specifically intended for a particular use, like with TANF, we know statutorily what it has been defined to do. And so, making sure that, families are self-sufficient, that children are able to stay in their own homes, like all of that makes sense within a TANF purpose. I think guaranteed income within the US right now is still growing and it's expanding. And I think that, as you described, right, it is meeting so many different purposes. It is meeting so many different people and so many different groups that I don't know that there can be a single answer to that, because I think that the moment and the place where we are in right now in the evolution of thinking about this unrestricted cash is necessarily going to need to measure a whole bunch of different things and a whole bunch of different outcomes. I think it might be too restrictive in this moment right now to try and be measuring towards a single outcome.
I guess there's some danger in that, don't you think? I feel like there is a lot of energy around this idea. And, I agree with you, like TANF is not just purely a guaranteed income, but I think you could make the case that the child tax credit is. Certainly the advanced version that was around for 1 year was more like that. And I've heard the head of RX Kids kind of say that was sort of the inspiration for RX Kids, but if there's not any sort of way to say this is working and here's how we know, expending a lot of taxpayer dollars or private dollars or anything for this continuously going forward, I think would be in jeopardy.
So I can tell you right now that I have colleagues who are far more knowledgeable and who are the actual experts in the CTC. Yeah. But what we know is that with the CTC, right, there was a significant decrease in child poverty. When the expanded CTC was made available, there was a very significant decrease in child poverty. And simultaneously, when it was not extended, when policymakers made the choice to end that expanded child tax credit, we also saw child poverty increase. So there is no doubt in my mind that the expanded CTC was effective. And I think that the CTC can be one example or one form of unrestricted cash provision. And I think that is some of what's being tested within the guaranteed income world right now is a whole bunch of different models, a whole bunch of different ways to set this up. And I think that's some of what the evidence is going to be showing us over time, is what many different models can look like and what outcomes from each of them can look like.
Aditi Shrivastava, Deputy Director of Income Security at the Center for Budget and Policy Priorities. Thank you for joining us on the Imprint Weekly Podcast.
Thank you so much for having me. It's been a pleasure.
Thanks to Aditi Shrivastava of the Center on Budget and Policy Priorities for joining us today. The Imprint Weekly Podcast is a production of the Safe Camp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or at safecampaudio on all major social media. This podcast is produced and mixed by Christine Anjoko with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we would love it if you'd consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we would greatly appreciate if you would support our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it's very easy. Just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews, and you can visit us on the web at imprintnews.org. You can always get us over email at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.